The medical device industry is highly regulated, and so first of all, to manufacture and distribute a medical device, you need to be licensed, appropriately licensed, which Gabler Medical is.
Right.
And then you need to have your specific device license, and we have received SAPA approval for emergency use during COVID. So the product is fully licensed to be able to be used in both public and private. So we completely covered there, which is great.
So you've been in places like Iliotdale, Zitulele. These are remote places. I believe you've also sent them out to the Central African Republic, Zimbabwe, DRC, the rest of the continent, clearly starting to think a little bit about a lot about what they might do if they have their own consequences of the pandemic. What feedback are you getting? I mean, has there been a tweaking process where people are saying to you, this is great, but can you just do a little bit more of this or that?
Absolutely. We had our first prototypes much earlier in the year. So we've been refining that as we go, based on clinical feedback, and our own as we've used them, we've been able to refine them. So they're quite different from the earliest units that we got out there, and
right.
We're quite happy with how the final product is hanging together. And the feedback from the field has been really great. It's not a silver bullet. I must make that clear.
Right.
There are some patients who are not going to tolerate it for one or other reason, or that you can't use it on. And it's important to say that this is not something you want to be buying and putting in your cupboard at home just in case. This is really for a hospital type environment, ideally where you're under a doctor's care, where you've reached the limit of what you can do with conventional oxygen masks. Then your option then is to escalate therapy to an ICU, and what our device does is it allows you to keep to bridge that gap, if you like, so that you can continue therapy at those low oxygen flow levels for longer in your basic facilities. So
in general wards and so on.
Correct. Yeah. It's not really for home use. I guess if you desperate and a GP is looking after you at home and you've got an oxygen concentrator, then fine. But that's going to be an absolute minority of patients using this.
News.
Experts.
Analysis.
Where things stand.
What you need to know. Drive home with John Perlman
On 702.